Good morning, we're here at Lexington Podiatry and we're going to show you a kissing lesion today. This is something that a lot of patients go through and they don't come to the doctor because they think they can take care of it on their own, which sometimes you can, but it's dangerous, especially as we age or if we're diabetic, to take care of any calluses or corns on your own. So here, when you're looking at the foot, between the big toe and the second toe, we have two lesions, one on the outside of the big toe, one on the inside of the second toe. These are usually bone protrusions and they're coming together and meeting, and we call that kissing lesions. So really, the second toe bothers her more, and every patient's different, but we want to take care of both sides. So we're ordering some x-rays for her. I'm going to debride the calluses for her and show her things she can do at home so that she can keep these away. So I do this a little bit at a time because some patients have a lot of pain. So I'm pulling apart the toes, I'm finding the excess tissue, and then just taking it off bit by bit. And this one wants to come off at once. See, I'm so sorry. That hurt a little bit. And so that's why I take it off in pieces, because if you try to pull too much at once, it can give just some pressure. But look, that one really wanted to be off in one piece. It's hard for us to do it, you know, where we have to pull the toe apart, and we do this all day, every day. So, you know, it's really hard for a patient to get down there and get something sharp in there. Sterile, that's not gonna hurt them. And then a lesion like this, obviously, is a little easier because it's nice and open. But this is just dead skin.
And a lot of people, we see that on a lot of people's.
Yeah, this is very, very common. Kissing lesions are common, but these IPJ lesions are even more common. So that's a reason to have inserts in your shoes and to wear good shoes. And afterwards, we always have the Dremel, and we'll smooth out the skin, because even if you do a really good job trimming it, it still will have like an edge here or there. So we like to get it as smooth as possible. So offloading these spots. You had said you had something that you wore in between?
Corn cushion.
Corn cushion. Corn cushion's definitely an option. We have a really cool device called a Toe Buddy that we'll show you. It's made of Silipose. And we also have something called Adessa. And Adessa is a keratolytic cream. So it's urea-based, and it looks like lotion, but it's not. It's not for everywhere. It's only for calluses. So what you'll do is you'll rub it right on this spot, and it will break apart that skin for you so you don't have to trim it.
Oh, great.
It works really well.
Great.
I've had patients, even with this up here, this is a knuckle pad callus.
Yeah, I was going to ask about that.
Yeah, you can use it on there too.
And they will reduce it?
It will reduce it.
Yes.
Yes, and then in between on here. And
Great.
it's gentle enough that I can trust patients to use it at home, but strong enough that it gives results.
Great.
Yeah. So that's part of what we'll show you today too.
Great.
Okay? And then we also use lamb's wool. Lamb's wool, and you just take a wisp of it off it comes in a big bulky pack. Take a wisp of it. So if you're wearing a shoe that's more narrow at the toe for a fancy event like church or a wedding, you can wisp the lamb's wool in between, and so it'll keep the pressure off but allow you to wear a regular shoe.
Wow.
Because some of those toe spacers are fat.
Yes.
And so you're like, well, I'd wear it if I could get it in my shoe, you know? So yeah, we've got lots of options for the offloading, and we'll show all those to you so you know what your options are.
Great.
Yeah.